OCTA Research Fellow Professor Guido David says the Philippines is already experiencing a downward trend of COVID-19 cases. OCTA expects COVID-19 cases to drop below 5,000 tomorrow and on Wednesday. This is good news according to Professor David, as they are also hopeful that Omicron surge is close to end.
But overall, I don't see any area na that's still on an upward trend. Everything's now going downward. Of course, hindi ko naman sinasabing tapos na sa NCR. We're just saying na it's we're getting closer to the tail end of the Omicron wave. So we're still at around 1,000. I think 1,600 or 1,700 cases per day, 7-day average natin sa NCR.
However, Professor David also reminded the public to not be too complacent because Omicron and even Delta are still existing. OCTA also has a new projection that COVID-19 cases may be down to 1,000 to 2,000 a day by end of the month. This is lower than the first projected 5,000 cases by end of the month.
Before, we were not sure about the trends in the other provinces kasi clear naman sa NCR na it's decreasing, but we were still unsure about how quickly the surge would last in other provinces outside NCR+. Pero right now, ang nakikita natin, pababa na sa lahat ng provinces. The trend will be sustained. And tsaka yung dating 5,000, it was just an estimate. Medyo upper bound siya, medyo overestimate siya. We're expecting by next week, baka nasa 4,000 to 5,000. And then by end of the month, nasa 1,000 to 2,000 lang. It could even be less than 1,000.
However, even if COVID-19 cases are now on downward trend, health experts can still recommend to de-escalate the alert level to 1.
We're not yet off the pandemic, no? We're still in the pandemic period. We still need to stay in the alert level 2, no? It's too early, and I think it's too drastic to change to a lower alert level like 1, no? Tingnan muna natin in the next 2 weeks kung medyo maganda ang palo ng mga kaso natin.
Private Hospitals Association of the Philippines Incorporated, or PHAPI President Dr. Jose Rene de Grano also said hospital admissions are low, but COVID-19 cases should be back to at least hundreds, similar to the recorded case trend during the pre-Omicron surge.
Try ko wag muna, let's wait for another 2 weeks before i-lower natin sa mga level 1. Kung kailangan natin mag-level 1. Kung talaga maintain natin yung ganun, and then ang ating positivity rate, let's say, talaga mas bumaba pa. Right now, it's still 20 plus, diba? Ibig sabihin, 1 out of 5, medyo nagpa-positive pa rin. Talagang malakas ang ng Omicron, it's very highly transmissible.
The government currently uses metrics such as healthcare utilization rate, 2-week growth rate of cases, average daily attack rate, and vaccination coverage. The government also recently added the availability of healthcare workers as a new metrics on deciding the alert level in an area. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.